thank you all very much for hanging around for this presentation. Today, for those of you that don't know me, I'm Lawrie Hooper, a member of the House of Keys for Ramsey and currently Minister for Health and Social Care. Unlike when I took the stage at last year's conference, I haven't just taken over the job this morning, so I should be able to answer some of your questions at the end of what I hope will be a very short presentation around nursing and residential care. So today it is going to be a very brief run-through of the proposals that we have recently taken through Tynwald that we are about to start consulting with the public on in respect of significant reforms to nursing and residential care on the Isle of Man. There are, it is fair to say, a lot of issues with how care for the elderly is provided and paid for on the island, as well as across the rest of the Western world. There is a lot of work going on across government to try and improve this. The work that we're focusing on today will be looking predominantly at how the island pays for care in our old age. Now, this work has been going on, as people will tell you, for the best part of a decade. It has taken this long because it is so complex and it will affect so many people. So today the plan is to give you a very brief update on progress and then the chance to ask some questions of our panellists today who have been heavily involved in the development of this work over the last few years. The focus will be on how care is paid for, not necessarily how those funds are raised. For that question, you may have to talk to the Treasury Minister, who I suspect is loitering somewhere in the audience to make sure I behave myself today. So the background to this, the Isle of Man's population is growing and is ageing. And as you can see from this graph, the Isle of Man has a very high percentage of people over the age of 65. It is, in fact, one of the highest percentages of over 65s in the world at around 22.1% of our population. That puts us, according to the UN, in the top 10 oldest populations on the planet. There are also some very large cohorts of people who are going to reach the age of 65 or over the next 15 years. In addition to this, the younger cohorts, as you go further down the graph, are smaller and smaller, which has the effect of increasing what's called the dependency ratio, which is the number of people working versus the number of people who need care who are not necessarily working. It is, I think, inevitable that as we all get older, we will need more care. That is true of us as individuals, but it is also true of society at large. As society ages, the cost of providing care for that older demographic will increase. And this is, without a doubt, one of the most significant challenges facing the island now and into the future. Addressing this challenge will be important for those of us that are facing paying for long-term care now, and those that will do in the future. Just as important is ensuring that whatever system we have is affordable for the taxpayer and is fair across the generations. And for the avoidance of doubt, what I'm talking about today is not going to avoid these increased costs. We cannot stop people getting older. The talk today is simply about determining where the burden of those costs should fall. Should they fall almost entirely on the individual who needs care, or should the state, the taxpayer, take a larger part of the burden? So, after reviewing various different models from around the world, the government is now focused on two different models for how this significant cost should be split between the taxpayer and those that need care and support, with the ultimate aim of creating a fairer system. The project is focusing on care for older people initially due to the demographic changes and challenges that our population profile faces, but we are absolutely aware that there will be other groups with long-term care needs who may be facing very similar issues in terms of funding, and in fact we heard about some of that just now in the conversation with Manx Care. My hope would be that if we can find a fairer way of funding nursing and residential care for older people, we can use those same principles to make the system fairer for the other groups of people who also need long-term care. The current position. Today, social care is not funded in the same way as the NHS, and that is obvious to anyone who has interacted with either system. The state plays a minimal role in looking after us in our older age, and the financial burden of care rests primarily with individuals and family members. Whilst there are some benefits and some financial support available, this is quite limited compared to the breadth of support offered by the NHS for healthcare needs. In simple terms, the current position is that people that need some care to live independently at home or that need care in a care home largely pay for it themselves unless they are in receipt of income support and benefits. There is currently no limit to the amount that people will have to pay for their care. But if people have used all of their assets, which will be all of their savings and investments, and if they've sold any property they don't currently live in, they will become eligible for income support benefits from the government, which will help towards the cost of paying for care. Now, we know that the way government supports people financially isn't seen to be fair, and that people very much worry about the cost of care and having to sell their house to pay for their own care or care of family members in their old age. In terms of fairness, some of the issues that we hear about quite regularly are that some people have all of their care paid for by the government, whereas others receive no government support at all. Some only receive support if they move out of their home to receive care in a care home, because there isn't the same level of financial support provided for people who need care at home. That goes directly against the department's policy of providing more care at or closer to home that Manx Care have just been talking about. Others struggle at home without the care they need because they simply can't afford to cover home care costs, but really don't want to leave their family home. It's my view that doing nothing here is not an option. Lots of people, I think, have experiences or have heard about experiences from friends or family where people have been forced into very poor financial situations or are in receipt of inadequate care simply because of a combination of their financial circumstances and their care needs. This is not fair. So, what are the objectives and principles for the change we're trying to seek? Following Tynwald approval in July, government is now investigating 2 new potential models for paying for care, which I'm going to run through quite quickly. The aim of bringing in a new model will be to make the system more equitable for everybody and to make it financially sustainable in the long term. Both of these models will see the state or the taxpayer take a larger part of the burden than is the case now, which would allow those who need care to keep more of their own assets. Previous public engagement work, going back to 2018, drew out some quite interesting conclusions from the public that can be summarised quite neatly. The first is that everybody should pay. That was the view expressed by the Manx public during that exercise. Most people agreed this payment should be throughout somebody's working life rather than at the point that you need care, and that it should be through some form of salaried contribution or an increase in or a separate form of taxation. Further public engagement on this is going to start in October. This time the engagement will have less of a focus on how government should raise the money, because this is the remit of the Treasury, and will instead focus on getting the public's views on which of these 2 models will lead to a fairer system for the island. So there are 2 models. I'm going to provide a few more details on those 2 options that are being considered. Under both of these models, financial support will only be available to those that have been assessed as needing personal care by a care professional. The free personal care model is currently used in Scotland. It is an NHS-type system where personal care is provided for free at the point of use. The mixed model, which is implemented in Jersey, combines contributions from both individuals and the taxpayer to pay for nursing, residential and home care costs. The main focus of this model is a capital threshold, which is the maximum amount of assets, which would include savings, investments or property, that a person can have before they are required to cover the full cost of their care without any assistance from government. The capital threshold would be set to recognise people have worked to build up assets they may wish to keep and pass on to family members as inheritance, and is designed to try and assist people retain some of their assets, but also with the expectation that some of these assets will be needed to pay for their cost of their care. This model would provide reduced support for people as their financial circumstances improve. Under both models, state support will be more tailored towards covering the cost of a person's care, with individuals being required to cover their own accommodation and living costs. Now, this is different to the current model where state support is provided towards the full fees paid by a care home, which usually would cover both care and accommodation costs. The free personal care model. Under this financial model, financial support towards personal care needs is provided to everybody. Personal care would include tasks of a personal nature that people need help with as part of their everyday living. So these would relate to hygiene, medication, feeding, bathing, dressing, things which we generally associate with care. Other care costs, such as housework or laundry or shopping, accommodation or living costs, would be means tested and supported by government for those that receive income support benefits. Similar to the funding of the NHS, where healthcare is provided free at the point of service, free personal care aligns with the principles of universal access and equality. It aims to ensure that individuals receive the care they need without having to bear the financial burden themselves. This model would essentially extend the NHS principles of needs and not means beyond health and into social care, and would be a big step towards the development of a true national health and care service. However, this model would take us a big step down the road of shared financial burden, and so would come with the highest cost to the taxpayer of the two models proposed. The other model, the mixed model, introduces a new benefit that ensures that financial support towards care costs is available to everybody that needs care, but those with more money have to pay for their own care for a period of time before they can access it. The amount that anybody will pay under the model is limited, which means that people would be able to keep more of their assets than under the current system. Financial support would be available from the outset for those with lower means. Government is still working on where it might set the threshold under this model, but wherever it is set, the threshold would be the maximum amount of assets a person could have before they would be required to cover the full cost of care without financial assistance. The higher the threshold, the more people would be able to keep. At the higher levels, people may be able to keep their family home, even if they were not living in it, to pass on as inheritance, but this would mean the taxpayer has to contribute more. As well as this threshold, there is also a lifetime cap on care costs, which means once a person has paid their costs up to this amount, the taxpayer will pick up the entirety of the rest of their care costs. In Jersey, this cap is set at around £70,000, which many people would reach between 1 and 3 years. Invariably, this means that anybody above the lowest income threshold could still end up with a significant care bill, although it would be much lower than under the current uncapped system. This model recognises the shared responsibility of the individual, their family and society in supporting care services. It aims to create a more sustainable system that strikes a balance between personal and public contributions. The exact thresholds and lifetime cap will be up to Tynwald to decide, but we will be testing some example levels with the public as part of the engagement, because setting these thresholds at different levels could fundamentally impact who receives support and how much support is received, as well as the overall cost of the system. So this diagram helps explain how the mixed model might work. The first question for the financial assessment to see whether somebody is eligible for support would be, do you own assets over the threshold amount? As I said, the actual threshold will be determined by Tynwald, but we will be testing some examples to see what the public think and to put the model into context for people. The suggested thresholds for consultation will represent the position of trying to allow people to keep a proportion of their assets. By way of an example, if we set the threshold at £350,000, people may be able to retain a property. But if we set it at £100,000, this would be unlikely. The higher the threshold is set, the more the individual will get to keep, but also the more the taxpayer will need to contribute to the cost. If the answer to this question is yes, the person does have assets over the threshold amount, they will need to pay for their own care for a period of time before they become eligible for financial assistance. This is where the cap on care costs would kick in, and like I said before, this could be up to 3 years. Modelling is ongoing to determine where a suitable cap would be for the island, but like I said, the Jersey model has this at around £70,000. If the answer to this question is no, people do not have assets over the threshold, they would be eligible for support towards their care costs straight away on a means-tested basis. This graph, this one's the killer. This estimates how the cost of care is split between the taxpayer and those who need care and support under the different models. These are very initial, very broad brush estimates using data available and assumptions that will need to be further developed throughout the consultation exercise, but they do give us a very clear indication of how the costs would change under these different models. In the first bar, which is the current system, the current model, less than 20% of the cost of care is actually met by the taxpayer, so the other 80% is met by individuals. Taxpayer support is focused on the costs of providing income support to those residing in care homes and providing care at home to those on income support benefits. It is estimated that currently those needing care and support are covering the vast majority of their fees themselves and paying for private domiciliary care in the home. The next bar along represents the free personal care model, and it's closer to a 50-50 split between the individual and the taxpayer. This represents around 54% of the costs being met by taxpayer as free personal care. The final 3 bars show how the cost might change if the mixed model was to come in and illustrates different thresholds being set. So the first graph to the third graph in represents a threshold of 100,000. This would slightly increase the percentage of costs covered by the taxpayer compared to today, but how financial support from government is allocated would change. For example, there'd be more support provided towards home care and less support provided towards accommodation and daily living costs in a care home. setting the threshold at 280,000 or 350,000, which is the last two of those graphs, would mean people would be able to keep more of their assets, would not be required to use them towards the cost of care. But as you can see, the cost towards the taxpayer then starts to steadily increase, much closer to the cost of the free personal care option. The higher that threshold goes, the more of your assets are protected, but the more cost is borne by the taxpayer. So, as we progress through this project, and as these reforms are hopefully going to become a reality, we need to undertake a lot of work on both of these models to see which would be the best for the island. How will they work in practice? How do we transition into a new system? Who should pay, and how should people pay? As well as a lot of other questions that we'll need answering. This is so we can go back to Tynwald next year with a definitive recommendation as to how to proceed. And this broad engagement with the public and providers is planned to begin in October. As part of this engagement, we want to help people understand the current system, which is quite complicated because it has organically grown over time, and to understand really where it doesn't work for people currently. We want to be able to explain these two new models to people so they can understand how they might work better for them or their families in the future. And we really want to listen to people's feedback. So as I mentioned at the start, this engagement is going to be focused on these two models and how they will apply to the island and how we fund care rather than how we find the money to fund care. We will be starting this in October, and the work has already started by talking to various private and third sector providers to let them know what is coming, to start to find out how best to reach people that they work with. We have a lot of information, a lot of questions that we're planning to share in various ways to try and reach as many people as possible. Successful reform will require widespread agreement and no doubt significant compromise between perspectives on fairness, so that we want to encourage absolutely everybody to get involved. Changes that are coming will be important for the older people who are currently in need of care, but they will affect everybody in the future. None of us know whether we may need care in our old age, and as both of these models rely on the taxpayer taking a greater share of the financial burden, this means the increased burden is likely to be passed on to society at large. And what this means is I would encourage everybody, even those that have no experience of the care system and who may think it's a long way off for them or their families, to get involved in this consultation exercise so we can make sure these proposals are fair to people of all generations. The team will also be looking to arrange specific sessions for providers of services to get their views on these models. Further information on all of this engagement will be pushed out through government social media channels and websites, as well as hopefully through newspapers and local radio stations. So now that you're all asleep, I think we will move on to the Q&A section of the event. So we've got probably about half an hour, I would guess, maybe a little bit longer to go through it. So thank you very much all for listening. This has been a very rough and ready tour through what's being proposed, and myself and my team are more than happy now to take any questions you've got. Please don't expect answers to everything. Like I say, we're very early in this process, and a lot of the questions that you ask actually are the same questions that we will be asking ourselves. Thank you very much.
Hi everyone, my name's Alison Teare and I've been asked to moderate this panel. Obviously you know the Minister, but if the other three panellists would like to introduce yourself, that would be great. Okay.
Hello, hi. For those who were here the last session, you might remember me. So I'm David Hamilton and I'm the Interim Executive Director for Social Care, Mental Health and Safeguarding across the island.
Hi, I'm Igoea and I'm the project lead for the Nursing, Residential and Home Care project within the Transformation Programme.
Good afternoon, everybody. I'm Will McCann. I'm an Interim Deputy Director in the Department of Health and Social Care for Strategy and Policy.
Okay, we have 6 questions that I'm going to ask the panellists, and then after that we'll put the mic out to the floor, and then if there's anything then that you want to ask, you feel free to ask. After that, obviously we have a time limit. After that, we would encourage people to, the panellists are going to be here. We do have a break for lunch, so you can come up and have a chat to them after that point. So the first question is to Nikki. So Nikki, will either of the new models mean that people no longer need to lose their house to pay for care?
So we know that people do worry about losing their house to pay for care. So this is something that we have been considering within the models. But we can't guarantee that any of the models will not allow people to lose their houses, because, as the Minister covered, the thresholds, if we set them too high, the model would become unaffordable, really, for government. So within the free personal care, we expect the costs to the individuals to be much greatly reduced than where they are now. And then in the mixed model, there is that threshold that I mentioned, but under both of the models, they'll still be means tested towards the accommodation costs for accommodation in a care home. So with means testing, it's always those with most means that do have to pay. But everybody's situation is very different. Financial situation, care situation, the choices that they make will be very different. So it's going to be different, really, for every situation. But I think in general, like I say, we have been thinking about this, and the government's policy is to allow people to retain more of their assets. So we think there will be a much less likely that people do have to lose their houses in future if these models were brought in.
Okay, thank you. Will, when are these changes likely to come into effect?
So in the first instance, our plan is to take a recommended options paper to Tynwald in October 2024. Naturally, Tynwald will seek the answer to the very question that you've just posed, which is, what will it take to move from a model into reality? At this moment in time, we can't answer that question, but the work that we'll start in October until next October will give us that picture, and we'll be able to kind of present that then to Tynwald. I think ultimately we recognise that the project is not something of quick change. It's more long term. And we recognise that Manx Care and private providers will go through some significant change. Ultimately, as a health and social care system, we all need to make sure that there is capacity. And when I talk about capacity, I talk about making sure that there is enough providers in the market, and importantly, the workforce that exists to be able to kind of meet those needs and those increased needs of people that will require support at home. Secondly, we will look to decide how we fund the model, and that will take a significant amount of time and work with our Treasury colleagues, and there'll be some changes to the social security system. Some of those kind of processes and procedures do take some time to kind of work through. And we anticipate that if Tynwald approve the recommendation next October, it would take around 2 years to implement.
Okay, thank you. Minister, if these new models are going to cost the government money and the costs will be passed on to the working population, how does the model align with the island's economic strategy?
Well, in short, the economic strategy envisages an extra 15,000 people coming, living and working here. All those people will be contributing towards the system. In fact, a lot of them will be working in the system, but there will be an increased need to, we've already heard that this morning about the need for carers, the need to have the right staff, the right numbers of people. It's true across the health and care service. So actually, the whole model really is tied very much into our economic strategy. One of the key arguments for doing this, in fact, is that it will encourage people to have the confidence to live their entire lives on the Isle of Man, knowing that if they've paid into our system, they will be able to retire in old age and be looked after almost. So rather than people moving here on a transient basis, dropping in and out of the system, depending on what suits them, they may decide to set down roots here. I think it's an argument that's been made by quite a lot of people, that if you have well-functioning health, care, education systems, it will encourage people to relocate, to stay on the island, which again contributes to that target growth population of around 15,000 extra people.
Okay, thank you. David, if it's the government's policy to provide more care at home and in the community, how will that be provided and what are the benefits?
Hey, thank you. So apologies for people who were here in the earlier session. You've heard some of this already. So I think that the home first approach is absolutely the right way forward. It is about enabling people to stay at home for as long as possible, providing it's safe for them to do so, as safe as it can be for them to live at home. So how we promote that independence and enable that to happen is key for us across the island. We've already started this journey. We have a number of services already in place that support that. However, there are some gaps, and I think there are issues around scale of some of those services, particularly around home care, for example. But equally, building-based services are things that we need to look at in the future. So there's a piece of work that started already looking at the needs of the island and the population of the island longer term. So as we're developing these strategies jointly across government and with local population, it's about what do we need in the future and what are the needs of the population. Some of that will be building-based, so there will be absolutely a need for some nursing care, dementia care going forward. I think residential care, as we know it now, I think there's a question mark over that, because if you think forward 10 years' time, people will hopefully be living at home longer and will have the support that they need to live at home. So that means that the residential care, people who are in residential care at the moment, should be able to provide and have some of those services provided at home. That requires us to make changes, as we discussed earlier, in terms of those services. Things like intermediate care, support for carers, which we know isn't where it needs to be at the moment. But work has already started with this and will continue to make sure that we develop those strategies and those plans and those services that will support people in the future. And a shift in focus as well into kind of prevention and early intervention to make sure that we're helping people self-care where possible. And we're also supporting people by connecting them to local communities. And there's a whole range of really good, positive services out there, led by the third sector and in local communities, that we don't always tap into and people don't always know about. So if we do that well, then that will divert some people from the need for long-term care and hospital care. It will reduce the need for some of that, and therefore that will be a better place for people to be, we believe. But we need to make sure we have those conversations with yourselves and the wider population, because we might think that's a good idea, other people might think differently. So we need to share those conversations and understand what people think and want for the future.
Thank you. This one's for Will. Is it cheaper to provide care at home than it is for someone goes into a care home?
Thank you. So the cost of providing care will greatly vary depending on certain factors. I think firstly, needs will be different. We'll have individuals with low-level needs who may need intermittent support. That may be a couple of times a day. And there'll be other individuals who will have more complex needs, either due to a medical condition or their social care needs that will require greater support. Naturally, providing care at home is more cost-effective in comparison to a care home, given the fact that you have to provide round-the-clock care, 24/7 nursing, the general overheads that a business would have to operate. But on the flip side of that, obviously, if there are complexities with the individual that necessitates a care support team to provide that support 3 times a day, 3 visits, 1 in the morning, 1 at lunchtime, 1 in the evening. And if they're doing that 7 days a week, then actually on balance, the cost would be more expensive. So there is a difficult balance in this process of trying to make sure that the funding model itself is considered. And that balance then that we start to kind of work through offers the choice, which is kind of government's policy. And we know that generally people wish to spend their time longer at home as long as it's safe to do so. But I think overall that kind of the costing dilemma will still remain as part of this kind of funding model at the very end of it.
Thank you. The final question from me is to Nikki. Who will this new system apply to?
Thank you. So that's a very good question and one that we're still working through at the moment. We're starting, as the Minister said, with a model that will work hopefully for older people, and then not forgetting that there are other people in society that have these sort of long-term care needs that will also need this kind of care and support. The model that we're focusing on will really focus more around care than accommodation, and we want a system that's fair across care wherever that care is provided. So whether care is provided at home or in a care home setting or some other setting that we perhaps don't have on the island or even maybe hasn't been thought of yet, things like extra care housing or assisted living. We want that system, the system in place for funding it to work for care wherever that's provided. In terms of sort of children also transitioning into care, into long-term care, we don't want any issues with where that might happen when if the funding system was different. So there's a lot of different areas that we're thinking about in terms of that. That will be a question that we want to talk to those service user groups as part of the consultation, because a lot of other people with longer term care needs aren't funded in the same way as was described by the Minister in the presentation. So that's then another large piece of work to see how those people would fit within this model, and whether from a fairness and equity perspective, we think that's the right thing to do for those different groups. Also within the model, there might need to be eligibility criteria in terms of whether that people have lived on the island and contributed to the system. So that's another question that we have for the general public. Should this be just available for anybody? But particularly with the free personal care model, I know when they brought it in Scotland, people were worried that people would move into Scotland just to get that free care, retire there for old age. So whether the models have to come along with some sort of rules around the amount of contribution that's been put into it before the care can be taken out. But they're all questions that we're running through at the moment, and that we will be very welcome to hearing people's views on as part of the consultation.
Okay, so thank you. And I know, obviously, we're at early stages with this, lots of conversation to be had, lots of questions to be asked. So let's make a start in the room now. Is there anybody here who's got a question for one of the panel? To the back. Oh, I'll come to you next. Okay.
Yeah, thank you. Obviously, for a lot of older people now, this wouldn't be applicable, but for younger people, you know, where the person may be 55 or whatever, if they have assets and the family wishes to inherit those assets, have you not considered the appropriateness of insurance, where the family would pay a premium, and then if, bearing in mind that different people would need different amounts of care for a lesser or a longer period, and you don't know when it'll start, it would be an appropriate thing for insurance to deal with. That the insurance would pay for whatever care is needed, and then the family could keep the assets, or they might say, no, we'll spend the assets.
So what we're, like I said, when I talked through it, what we're not looking at this stage is how we raise the money for this. So an insurance model could very well be the way that people pay into the system. That could be perfectly reasonable. One of the other models could be you pay for it through taxation, or you could continue to pay at the point that you need care in the first instance. The challenge with an insurance model obviously would be needing to get the insurance industry to offer those sorts of products. I'm not aware that they currently do at the minute. Nowhere in the UK, for example, that's the market. So we would be trying to create an insurance market for 83,500 people, only a subset of whom would actually be buying the insurance anyway. So is it realistic, I suppose, to do that? I don't know the answer. It probably needs to be a government-backed or government-run model. I don't think that's an unreasonable question to ask. It is something we're going to have to think about as we go through the conversations with Treasury about actually how are we going to fund these changes to the system, and is an insurance model the way to go? Nikki talked about residency requirements. It could even be the case that we turn around and tell people, if you live here for the first few years, you will have to have some form of insurance because the system can't be expected to pick up significant costs on your behalf if you haven't contributed. All these are very live questions at the moment. So it's a really good one to ask, and it is something that's going to have to be part of the mix, I think, when we start to talk about how should we actually fund some of these changes.
Thank you, Minister.
In your presentation, Minister, you were saying that the financial considerations have been going on now for 10 years. Given that we baby boomers were all born in the 50s, and it's common knowledge that we were baby boomers and that the demographic bulge would continue to go through the population, what I want to know is why this wasn't worked on earlier. Now, I know it's not to do with the current thing, and probably it's because everybody just looks 5 years hence. But the information has been there. Also, the business of attracting people over to the island has also been done. That's how I arrived here as a school girl, and now I'm pensioner. Now I'm heading that way. And the same thing is going to happen when you increase the population. If they are happy to come over and make roots, eventually they will be So it's an ongoing thing, which, you know, is that taken into consideration. I would have quite liked the idea of doing just in the same way as you have life insurance, is to have some sort of insurance which would cover things like that. I'm not averse to paying towards it. It's just that it does need to be fairer.
So I think the answer to that question is twofold. I could spend all day talking to you about the failings of our political system that actually encourages individuals to stand as independents and then to only look towards the next 5 years. Our system does not encourage long-term planning and long-term thinking, because quite often what you're doing is sacrificing in the short term for a long-term benefit, and politicians by and large don't do that. The system doesn't encourage them to. So I would all encourage you to vote for a political party at the next election, because in theory there's some continuity there. But the reality actually is, because despite my personal view that we need to do something about this problem, the reality is we actually don't. We could say we're quite happy with the current system where it's essentially every man for himself. We could just keep doing that forever. It's not really financially sustainable. It will cause all sorts of other problems, because the private sector, we know, is struggling to recruit. The fee levels don't quite work. It will get more expensive. There'll be more people, more demand. But arguably, you could allow the system to just perpetuate, which is sort of what they've decided to do in the UK. They had conversations around a threshold and cap model, which they just didn't bring in the end. Again, I don't really know why, but political considerations is most likely. So the reality is we could allow the current system to continue to limp on. There is no pressing imperative other than, as you absolutely rightly point out, it's just not fair. And it should be fair, and so let's make it fairer. So that's essentially why it does tie in quite heavily with, like you say, attracting people over, needing to think longer term. We're trying to think longer term as a government. That's something we're trying to do with the Island Plan. It's something the department's trying to do with its more strategic approach to developing some of these things. But it isn't something that historically the Isle of Man has been very good at. These proposals were first mooted, as far as I remember, conversations in 2013 about these. This isn't necessarily a new stuff. There was a report done in 2016, there was a select committee, there's been all sorts of work which essentially goes around the same question over and over again. And it's difficult because ultimately we're going to be asking the public to pay more, you know, either pay some insurance or pay some national insurance or whatever it may be. Ultimately, when you've got politicians going back to the public saying this is going to cost you a bit more, but you may not personally benefit from it because you may not need care in the old age, it's a difficult sell. And I would imagine in the 40s when they set up the NHS, they had the similar kind of issue, asking people who, young, healthy, fit, never thought it was going to apply to them, to contribute to a system they may never actually benefit from. But it feels like it's the right thing to do as an island, as a society, to have these conversations now and to start saying, let's make it fairer for everybody, because we do have a very old population. It is only going to get older, and actually I've never felt that it's fair to tell people who are either in need of care or who think they will be in need of care to say, you're basically on your own, good luck. That doesn't seem right to me.
Okay, next question.
Obviously, sorry, Jackie Bettridge from Crossroads again, for anybody who was here before. For me, yes, we've been part of it. We have been speaking to the team around this. But fundamentally, if you are going to keep people in their own homes, those very people that they live with, such as this lady, they are generically known as carers, are not getting their carers assessments, which is enshrined in law, and we ought to be ashamed of ourselves. Crossroads is actually 40 years old, and we have been plugging this for 40 years. Now I am going to take a tough line, because you can do this all you want, but if you cannot respect the very people that you're asking to look after, people who are in need, then there's no point to this at all. Seriously, the very people that are looking after their loved ones need to be recognised. And if we can't do that as a fundamental, then there's no point to any of this. There's no point looking for funding, there's no point to any of it. And on the flip side of that, trying to get people to work in the profession is incredibly difficult because it's not a properly recognised profession. And it's outrageous. So if this government wants to do anything, that is your starting point. Whilst I'm quite happy to help with the model, to do the transformation piece, we have to have an absolute understanding of what we're actually asking people of the Isle of Man to do.
Minister, do you want to take that?
Yeah, so under both of these models, the intention is that the state plays a much larger role in the delivery of care. That's one of the things we're trying to do, because as I acknowledged quite early on in that presentation, around about 80% of care is not provided or supported by the state. There is a heavy reliance on carers, on family members, to step in and look after people, because the financial support isn't there. We don't pay for the right amount of care. We don't pay to put people in the right care homes, for example. It doesn't work. People get what's given to them as opposed to what they need. The whole purpose of this is to rebalance that entire relationship and say it is not fair to tell people you're on your own.
I hear what you're saying about pay, but these people, so if tomorrow your loved one had a stroke, you went into hospital, you came out, and the carer has not had an assessment to see if A, they can do it, do they want to do it, are they able to do it, is their environment right? We're not doing the very fundamental bits of care.
Yeah,
It's nothing to do with how much it costs.
I'm not talking about cost.
But you just
No, what I'm talking about is who is responsible for delivering it. So under these models, actually, the understanding would be that it is not up to the carer to need to do those things. It should be the state that steps in. So in the same way,
stay in their own homes,
yes,
husbands, wives, mothers, daughters, whatever, whoever's ever doing the care, is entitled in law on the Isle of Man to have a carer's assessment, to check that they are okay and able to do that. At the moment, this doesn't happen.
yes, I know. That's exactly, we're saying exactly the same thing here. The current system is broken. And if I was talking about just perpetuating the current system with a bit more money, I'd be an absolute fool. That is not what we're talking about. We are not talking about perpetuating an existing system where we rely on people to do more than they're actually able to. So part of the gap in the moment is, you're right, people aren't getting these assessments and people are almost just being left to themselves. Say, well, you have to care for these people because there is no extra support for you. That isn't right. Of course it isn't right. And we have to resolve some of those basic issues. But actually, even if you were to give people a carer's assessment and say, actually, we don't think you can cope, where are the resources then to put in help for those people who need extra help? Where are the resources to do the home adaptations that may be needed? They don't exist.
But if we had been doing it, we'd have a lot more data. It would be very much more informative.
Yes, absolutely.
This model, because we need that to inform where we are as an island, and we just don't have that.
Yeah, absolutely. And I can't change the past as much as I would like to say, yes, for the last 20 years, government should have been doing these things. But they haven't.
I think
I'm
David
not
would
really,
like to.
I'm not really sure what it is
add.
I'm expected to say to that, really.
Hi, Jackie. I think there is an opportunity, isn't there, just to build on the work that you've led in terms of Crossroads and the strategy that's about to be developed around that as well, to think much more around the carers' assessments, to make sure that we're doing them as best we can, thinking about who should be doing carers' assessments in the future, so there's options around that as well. It doesn't have to be done by statutory agencies. We have to make sure that they're done, but who does it is up for discussion, I think. So I think there are some real opportunities to address some of those concerns that you have, and they've been concerns for some time, I know. And I think that we can move forward with that in terms of that carers strategy. But we do need people to get engaged in that more, in terms of those recommendations and how we collectively address some of those issues, because it is, as I keep saying, a whole system issue, isn't it? It isn't just about Manx Care doing this or about governments, it's about local communities, it's about the third sector, private sector. So I think the more we can work together on that, the better. And I know there's intentions to do that in the near future.
Could I just jump in on that one? Just to build to David's comments and for the benefit of the room, the department is committed to developing a carer strategy. Work is ongoing. We're proud to say that that work is in conjunction with Crossroads. Earlier this year, there was a publication of a carer survey. That's given us rich detail and information in terms of the needs of carers, not just now, but in the future. We're in the process of refining the final strategy, developing that action plan of which the carers assessment, as David's alluded to, will be part of that. And I think there's a great opportunity to correct some of the wrongs that have taken place over the few years, and hopefully we can get ourselves on a pathway that carer strategy can support the work of the Nurse and Residential project.
Jackie, can I just ask, are you happy that the question's been answered as far as it needs to be answered for now? And what would you like to see as your next step?
As our next step, we talk a lot about carers assessments, and we go, it could be done by this, it could be done by statutory, it could be done, it needs to be being done.
Okay.
Not when, how, if and who by. it actually needs to be done. Because to actually build your model of keeping people in their own homes, the very, very start is who the hell are they living with?
Okay.
And we're not doing that. And you're right, it hasn't been done historically, but I still have a fear that it won't going forward. And the model will just collapse. Because like this lady said, before anybody was in the room, when she needed help, she wasn't very well, and she's looking after somebody that is bedridden, the system isn't there.
Okay, so Will, are you saying that you are happy to take that forward now?
Yeah, that's fine. Yeah, no problem.
Yeah, okay. Okay, next question.
I won't shout at you. Kev Wilson, Crossroads. Really, two questions. One, how does this inform other government policy? Because it's all very well to have this in writing how we're going to develop it. But actually, if you have a look at the housing stock of the future, how you keep people in houses, how do you reduce costs, all those things will have a play on this. So we might have a strategy in 2 years' time about how we're going to adopt it, but actually it's going to be 10, 15, 20, 25 years' time when it will come into reality. So how do we ensure that the island is prepared for that? And if we are prepared for that, it reduces the costs that we're spending out, reduce the costs on individuals now. So that's, I suppose, question one. Is it cross-cutting? Are those conversations going to happen? And the second one, I suppose, is how do you prevent cost again? And is the prevention in gender? And I know we're going back to the previous discussion with regards to that. But how do you stop things from getting worse? And what I don't see or hear necessarily is a prevention agenda being talked about that often. About recognising very, very early something that's going to develop in the future. And we can see now where a child perhaps is going to have care needs in 50, 60 years' time. And it's what do we do to prepare for that? And I'm not entirely sure that the system at the moment is entirely geared up for that. And it certainly doesn't speak to each part of it. And the transition through life for those individuals isn't as easy as it needs to be, and it isn't joined up as it needs to be. And the basic point, which I think Jackie was alluding to in part, was just about how do you respect people who are going through the system and recognising them and as people first, and then how do you value those who we ask to care for our loved ones? Because the other thing is, I'm not entirely sure the society is terribly good at valuing those people until such time as you need them. And then you really get a sense of their worth. So sorry, two laboured questions, but I think that for me they're quite important about how we go on.
So the answer to the first one's quite easy. Yes, in short. So this is being supported cross-government, this piece of work. It's very specifically in respect of housing. I'm not sure where it is this afternoon at 2:30. We'll be talking about housing associations and further development. So if you want to have a long conversation about housing, I think yours truly will be on stage talking about housing in about an hour and a half. But yes, you're absolutely right. You cannot solve this problem in isolation. And as I think David alluded to and Nikki's both talked about, the development of different types of housing and care provision, extra care, we don't have that on the island. We have a very black and white system. A kind of a more tiered model is something that's going to be needed. And ultimately, even if we do adopt a kind of home first approach, it's called home first, not home only, for a very good reason, because there'll be lots of people who by choice or necessity will need different types of accommodation, whether it's adaptations in their own home or specific dedicated facilities or premises built for them. So that is absolutely going to need to be done hand in hand with how you actually roll out and deliver whatever care looks like in the future.
David, sorry.
Yeah. So in terms of prevention, early intervention, you're absolutely right. That is something that we need to be more focused on. There are conversations happening now and some work happening now, particularly around the wellbeing partnerships, that will be looking at that early intervention. How do we identify people who have support needs at that stage early enough to prevent it becoming a crisis? And what do we do to support those individuals in communities, with communities, not necessarily through statutory services? I think often by the time they get into statutory services, we've missed those opportunities to work with those people and support them there. So I think the better we get at that, the sooner we do that and get those things implemented, the better. We're on that journey already. There are lots of services already in place. We're planning to do more around that, but it isn't a quick fix either, because we know that public health colleagues need to be involved in that. It is about self-care. It is about the wider environment in which people live. So we know where people live has a massive impact on their health and well-being. Their local environment has a massive impact on their health and well-being. So it's much wider than just the health and social care agenda, as I'm sure you know. So how we collectively work on that again is important for us, and how we join that up across different agencies, different services, and involving the public in that as well, because everybody has a role to play in that.
Okay. We have time for one more question.
Hi. I'm interested in, from a perspective of attracting people to the Isle of Man. Obviously, I represent actually a group of professionals, which we have quite a difficulty in attracting here. How you think that growing the population to whatever you're saying there is going to actually provide the finance to do this? Because you could attract people who haven't got the income to actually have this economic impact that you're talking about. Is that the only model that the government has in its economic strategy? Or are you also looking at other forms of taxation, perhaps from those who have companies here, the e-gaming, etc., contributing more into the infrastructure in the Isle of Man to help the future of the population? And the other side of what I would also like to ask as well is, you've looked at two models there, the Scottish one. I'm very glad you're looking not at failing models, at some successful ones, but are we comparing like with like? Because of course in Jersey, they don't pay the same level of national insurance that we do. So are you going to consider bringing that in, but also upping national insurance, which is a huge economic effect on the population here? And finally, from a personal perspective, I have very elderly parents on the island who are in their 80s, who I'm trying to offer, help at home. And I just want to say here that those who are delivering the help, for example, there's the long-term conditions nurse service. There are only 4 on the whole island. Now, they do a fantastic job. I'm lucky that I have the skills to interact with them and get the things that my parents need in their late 80s. But lots of people don't even know of the existence of the long-term conditions nurses. I'm also very glad to hear that there's going to be a geriatric consultant to look at the various health issues that older people may have, to look at it in a more holistic way. But I do think we need to shout out as well the successes of those who are actually on the ground delivering these services in quite difficult situations because of what they have to cover. And I can only say from my own personal experience here with my parents, actually supporting people in the home who need a certain amount of support is really the most beneficial way to go, because the cost effect of that, and they get a couple of hours, each day, just on a 5-week basis, just as an example, but it helps them stay at home. But both have very, considerable long-term conditions, but yet they're able to stay at home. And there is that, obviously, the aspect of family helping too. But the combination of that as a community is what keeps them at home. So I know that's a bit all over the place, but there's different things there that I think need to be considered. And I hope in this consultation, again, with, not a degree of cynicism, that consultation really means consultation, and that you also consult with those who represent groups of workers on the island as well, because often these government consultations, it's whatever number of people in a hall, and then you go somewhere else and a number of people in the hall. Is that really representative of the different interest groups on the island? It needs to be. It really needs to be. Thank you.
So I think you're in the wrong room talking about the economic strategy. The Treasury Minister has been in the main hall, and probably could have answered all your questions around taxation. We're not talking about taxation because the Health Service doesn't raise taxes. It's not something we do. I know, like I said in the presentation, I'm not here talking about how you fund it, because that's not my remit. I have my own views on how we should fund these things, but I'm not the Treasury Minister, and it won't be my decision ultimately on what path is taken. So we're talking about actually who shares the burden and how that's delivered, rather than how the funding is raised in the first instance. I think you're absolutely right to call out the good work that goes on already, and we don't do enough of that. Actually, we should shout more about the commitment that people have, and actually they'll go above and beyond, let's be honest. Most of them do a hell of a lot more than we ask them to do, simply because that's the type of people they are, and that really does need to be celebrated. In terms of engagement, I think we're planning on doing lots of different forums, so face-to-face, online forums, whatever it is we can really to reach out to as many different people as possible. We do quite often reach out to the various groups within health and care, the unions represent them, for example, staff side representatives. We can only put this stuff out there. I can't force them to engage. You get varying levels of engagement from the various bodies depending on how interested they are, I think, in particular issues. I know when I talked to the RCN about these proposals quite recently, they were very engaged. They were quite happy to come forward and talk because they represent people, nurses and staff that don't just work in the health service but also in the private sector. And so they were quite keen to engage, and I think they will be one of the groups that does engage quite heavily in this from a staff perspective, actually, and talking about some of the recruitment challenges that they face and some of the challenges that we know exist for staff trying to actually deliver some of this care in the first place. So we are really open to talking and listening. We don't have any fixed ideas. We don't have most of the answers to the questions we need to ask at the moment. We sort of know what questions we need to ask, but we really don't have the data, as has been alluded to already, to answer some of those questions. That's what the next 12 months is really about, is trying to understand what are we missing, what questions should we be asking, what data do we have, what data is missing, and actually not just some of the longer term stuff, but what can we do more immediately to fix and plug some of the gaps in the system that currently exist. So it is massively complicated, and I do appreciate your questions because I know they're coming from a good place, and I think you're right, actually. We can't think about this stuff in isolation. It has to be done on that kind of cross-government basis, and it has to tie in with some of the other things that we're doing as well around the economic strategy, population growth, housing, whatever it is. We can't just pretend that we're out on a limb in the health and care service doing our own thing. It's far more complex than that.
Okay. So one question from me just before we wrap up, and as I said before, if you have got any questions, we have got just a very slight break here, so just come up to the front and feel free to have a chat. A lot has been said about communication, and I'd just like to know from the panel or from whoever knows about this, we've talked about communication. When will people just start to see those communications? When will they be asked questions? When will those forums be available?
So yeah, I'll take that one because I'm leading on that. October, towards the end of October, will be when you start to see the big focus on us going out and talking to people, but we are starting a little bit ahead of that. So between now and October, start to gradually see. I think we've been invited to speak to some Manx care staff before that. I know we're going to speak to the Women's Institute before that. Wherever we've been invited, we'll start going out and it'll start to roll out. But sort of from the end of October, that's when it'll really ramp up.
Okay, so if anybody's got any ideas where communication should go, maybe just mention that to Nikki. Obviously, it's the press, social media and that kind of things will be covered as well, but any areas where you think that might help. Thank you, everybody, today for being here, for listening. I really appreciate everybody's questions, and I'm sure the panel do as well. It's a really tricky conversation, and the guys will be here afterwards. Thank you.